healthcare is very, very, it's a very busy lifestyle, should we say? You know, doctors are very busy people, and that's only going one way. So it's been getting harder and harder for them to dedicate time to spend with reps versus patients. And then you have, you know, a global pandemic that, you know, locks down the entire world. Like, you know, try and get a rep in to see a doctor in this environment. And, you know, that's really accelerated things. So they're spending more and more, well, they have less and less time to actually spend with a physical rep, but they have more and more sort of digital touch points.
Welcome to 20-Minute Leaders. Just sit back, relax, and learn from the leaders of today. It's a journey. Each one is different, unique, inspiring. Let's get started. This episode is powered by J Ventures, a community-driven VC fund in Silicon Valley in partnership with Leumitech, sponsored by Homeward Ventures, Hippo Insurance, Upwest Labs, Synergy Global, Hillel at Stanford, Leap, Birthright Excel, Serona Partners, and in media partnership with CTech. Welcome to 20-Minute Leaders. Today we're talking about physicians, but in a different point of view. Meet Gareth Shaw, President UK and Europe of Doceree, the world's first global platform for programmatic physician marketing. Prior to Doceree, Gareth worked on the senior leadership team at PulsePoint, where he helped scale the business to the point where they were strategically acquired by WebMD. Gareth has over 15 years of experience in digital holding roles at Yahoo and Experian. It was at PulsePoint that he began his journey into the health vertical. He has lofty aspirations for the role Doceree can play in improving healthcare globally through more effective physician engagement. Gareth Shaw, welcome to 20-Minute Leaders, President of the United Kingdom and Europe of Doceree. How are you?
I'm very well, thank you. Thank you for having me. Looking forward to being here.
I'm just curious to learn about what it is that you do, Gareth, because it sounds really relevant to today. It sounds like a modern way of thinking through, you know, physicians and doctors and how they interact with the world around us, and how do we as the world interact with them, and looking at what Doceree is doing with physician-only programmatic marketing. So, Gareth, first of all, what does that mean, Doceree, physician-only programmatic marketing?
Well, that's a great question. So, yep, we're Doceree, and we are the world's first global physician programmatic platform. What does that mean? So, if you look at physicians or doctors, you know, it's not a unique profession, but it's you know, it's one of those professions where you need to constantly be up to date on what's happening. You know, you could have qualified as a doctor 40 years ago, and medicine is very different, you know, today than it was last year, let alone 40 years ago. So a big part of your job as a physician, you know, is continual medical education and making sure you're up to date with the latest therapies, treatments, all that kind of good stuff. And to do that, you know, they have to go and find that information. And then you have, on the other side of the equation, you have like the big pharma brands, the big medical device companies, the companies that are really investing in the R&D to progress medicine. They want to communicate, you know, all the great stuff they're doing, the research development side, all these new things they're launching to improve patient outcomes. So really, what we do is we are a platform that sits in between, you know, a life science company that wants to potentially educate a physician on the latest treatment or therapy, and the physician themselves. And we do that in a programmatic environment. What programmatic means really means just using programs to market or automation. So if you think about how our lives are kind of dominated by digital now. So we're talking now via video conference, very digital. So you think about how a doctor goes about their day to day. You know, they may go, oh well, you know, I'll log in. You know, it's probably when you go to the doctor, it's like when I go. You know, they'll be talking to you from behind a computer screen, tapping away notes into your electronic health record. Yep. You know, that's a digital touch point for a doctor. They may go to a medical journal to read up on some of the latest research. They may go to a continual medical education site to take some accumulate credits. They may go to a networking site. There's all these different digital touch points, and there's so much, you know, opportunity. Well, so much data swimming around, and you know, in terms of what are they doing right there and then. And, you know, it really is, how do you put the right message in front of the right person at the right time? And programmatic just allows us to harness all that in real time. So, you know, if one physician is on the British Medical Journal reading a particular article, we could serve that physician a completely different message from the next physician that actually sees that page in real time. They could be standing side by side with their laptops and see different messages based on their interest or behavior. So really, we connect life science brands with physicians, and we do it in a very, very targeted surgical way.
Take me back to the personality of a physician, because I think what you're mentioning here is super, super interesting, because I'm thinking about myself, for example, as an engineer, and I'm thinking about, some ways in which I get updated as an engineer, very similar to a physician. I can be trained as an engineer, but now I have to be up to date with the evolving, languages and the evolving tools that I have at my disposal. And it's quite difficult, but what is it about the physician day to day, or perhaps personality, that lends itself to saying, okay, there's this niche market here that there's a large enough opportunity to create a company like Doceree that is tailored for them?
Yeah, that's a brilliant question. So traditionally, this kind of like education piece on, what are the latest advancements coming out from life science was done by sales reps. Yep. And they would go around and they would visit doctors and hospitals and surgeries. They'd go in and they'd spend an hour or however long educating the doctor. Here's the latest journals. Here, physically, giving them reading material and things like that. Healthcare is very, very. It's a very busy lifestyle, should we say? Doctors are very busy people, and that's only going one way. So it's been getting harder and harder for them to dedicate time to spend with reps versus patients. And then you have, a global pandemic that, locks down the entire world. Like, try and get a rep in to see a doctor in this environment. And, that's really accelerated things. So they're spending more and more, they have less and less time to actually spend with a physical rep, but they have more and more sort of digital touch points. So it's about, catching them, because we're looking, whether it be a point of care platform, so whether they're using an electronic health record, an e-prescribing app, or, whether they're on a journal or an education website, because we know the environment they're in, we can be quite structured in, pushing those little messages out that like, oh, it's the exact right context. Our big USP is, we are engaging those doctors when they're in full work mode, when they are, if you need to talk to a cardiology about a specific topic within cardiology, we can put that message, in that place. If you want to talk to a general physician around coupons or copay cards to subsidize a patient's prescription costs, in the US, we can do that because at patient intake, the platform, they'll know the insurer. And then if they prescribe a certain medication, we're not going behind the HIPAA wall or taking any PII or anything like that. But because we're in that environment, we can suddenly say, oh, you just prescribed X. Did you know that you can hand out this this coupon? Right. Physicians love it. Patients love it. It's good for everyone.
Is there any factor of building trust with the physicians as Doceree is running today? Is there any form of trust that needs to be built here?
Well, 100%. Trust is the key to everything. I find my background was search, and then more broadly sort of digital media across all formats. And then I went and worked at Experian on the data side for a while before going over to a company named PulsePoint that sort of pivoted into health about 5 years ago. And I would say throughout my whole sort of digital journey, going from selling media to selling data to then getting involved in advertising technology startups and the health sector, is trust powers everything. So we are sort of almost an intermediary marketplace. So the physician has the relationships with the electronic health record platform or the journal publisher, but we then want to have a relationship, with that publisher or platform to help build the trust there with the physician. Every time the physician goes to that platform, we want them to be getting value. We don't want, the early days of programmatic advertising on the general internet. I'm sure a lot of people had that experience where they were stalked around the internet by an ad for a pair of shoes or something like that you probably purchased, but the ad followed you around for 6 weeks. We don't want that creepy stalkery feeling, and we also don't want to hammer people with ads. We want to be very, as I say, very surgical and provide valuable clinical messaging. So that's the side we talk to with the supply side, so the relationships with the physicians. So we want to enhance the trust those partners have with the physician by adding valuable content to their platforms. And then the other side of the equation, we definitely need to build trust with the life science companies. So, the pharma brands, the medical device companies, because this is a highly regulated industry, and if you get it wrong, there can be very big fines. If you promote something in a market where it's not approved to be promoted, or you promote it for it may be approved in that market, but if you promote it for something it's not approved for, and various other different things. So I'd say on that side of the equation, so on the demand side, with our clients there, trust is paramount, because the low bar isn't saying, oh, well, we understand all the regulation and we're completely compliant. The low bar is we understand all the regulation, we're completely compliant, and we can articulate to you in a simple, easy to understand way, because the low bar is convincing the compliance team, whether it at the brand, that hey, this is great, my marketing team love it, it's innovative, I'm going to get my right message out to the doctors, I'm going to drive engagement, it's going to be great. And then you get this compliance team like, are we going to get a huge fine for doing this? And you have to be able to clearly articulate to those guys. So trust is paramount. And looking at my role specifically, we launched originally in the Indian market, which for me joining the business was a massive thing, because there are a few companies doing programmatic advertising in the health space in the US. The US is somewhat of a unique market in terms of the regulation and how you can advertise to physicians and patients. New Zealand's the only other market that really works like the US. The rest of the world, you can only advertise you can only show any messaging to do with prescription drugs to doctors in very specific environments.
Wow.
So, we have to be able to kind of clearly articulate that. And the fact that we did it in India and then we went to the US and now I'm coming to Europe, it's very easy for me to say, well, I'm just layering on. It's like, well, first thing, I only work with endemic environments. I only work with places where doctors go. I'm not on the open internet. I'm not, showing an advert or a message to a doctor when he's on CNN.com. That is not what I do. I'm only on an environment that only a doctor would go to, preferably behind a login. And building that trust and then layering on the innovation. Because if we, programmatic advertising, it's probably 10, 15 years old. And if we try to go in at 1,000,000 miles an hour and said, right, we can do all this great stuff immediately, some people would get excited. And then everyone with a legal background would slam the door on our faces, because it'd be like, whoa. So it's about building trust and then layering on innovation around that, and keeping things simple.
So is it something special about physicians where they are right now an ideal audience for such a thing, or do you see this as something that can be replicated or something that can be leveraged for a variety of other professions that in a similar nature require that constant updating?
Yes. You could, if you look at how digital advertising works, within the consumer world, so much innovation around personalized ads. There's regulation out there like GDPR in the EU, that means companies have to use data in responsible ways. But then you look at how much GDP goes into healthcare. How much R&D budget goes in, how much advertising. It's a huge industry. It's very underinvested in digital because, as I mentioned earlier, it was very rep driven. And then also, if you look at the amount of data available, they're not the biggest audiences in the world. I think it's like 1.2 maybe million doctors in the US, 1.7 give or take, in Europe, including the UK. But the amount of information, because with digital going crazy in terms of the applications of all these different digital platforms that people use to make their lives easier, and doctors, and digital health records and things, with that coming out of the States, being pushed sort of globally, the data is all there. That you can build these very, very meaningful kind of moments where you can engage and interact with a physician, because maybe 10 years ago, we might not have been able to do what we're doing now. So yeah, I think the opportunities, it's a huge market. It's massively underinvested in digital. And we're now at a point where the technology and the data, it's all kind of there, that if you understand the regulation and you do it in a responsible way, we can really accelerate, what's happening. And really for, our kind of vision is we want to empower physicians, with the most up-to-date information so they can do their jobs better. It's not around, we're not an advertising company. We serve advertising and promotional clinical messaging, but really we want to be a sort of data and insights company. We want to understand, how particular physicians behave, how particular brands, should be thinking around, not just, where, I want to get in front of cardiologists. Where do I do that? Yes, we can do that. But what is it you're bringing out? Is it just cardiology? Are there other kind of specialities that overlap that you should be considering? And really sort of, become special advisors to the brands on the audience they should go after, and then the best way to find that audience and engage them digitally. And as the world accelerates with digital, I'm sure we won't have many dull days in terms of innovation.
Where's your passion coming for all of this? This deep understanding. Obviously, you're very curious about what you do, and you truly believe in what you do. Where is this stemming from?
So I suppose I kind of, as I say, I started my journey sort of working at Yahoo.
Yeah.
Selling search, and then I started selling sort of digital media, and I really enjoyed my time there. And then I went and did a little bit in the data side. I kind of, without knowing it, sort of touched all these different elements within the digital sphere. I put myself in a good position to go to a startup, and then I got employed by a company called PulsePoint. I never really looked back in terms of big companies are great, but little companies, when you're building something, was brilliant. And that kind of, identifying a problem or a need or an issue, and then building something to solve it or disrupt, I absolutely love it. The best bit about my job is I almost feel like, there's a series of puzzle pieces that I need to find, and then I need to put them together to make the picture that we're looking to get to. And I really enjoy that kind of, building and orchestrating and, building coming up with a vision, building a team, and then executing it. And, when I was younger, showing ads on the internet, that was great for paying my mortgage. And now I'm a little bit older, I kind of want to have something a little bit more meaningful to look back on. And, working in the, like healthcare, I think, the US, the UK, most of Europe doesn't work as well as it could. And anything we can do to bring efficiency to it, it's something I can look back on and be kind of proud of.
I love it. If you're looking now at your what you do today and the impact that you have, you're talking quite a bit about the impact on the physicians and the market, and then obviously the ripple effect is huge towards the end customers. Is that a big part of the journey as well? The way that through educating the market and through providing the access to these new technologies, you're by default then, and the transitive property, you're making an impact then on the people that are then getting affected through these physicians?
No, definitely. if you pull it all back, it's all about, delivering, a big buzzword in the healthcare industry is patient outcomes, but that's what it's, all about. It's, how, and not even, I think probably delivering a sort of patient outcome is like someone goes to the doctor, you want to get them well. You can even go beyond that. It's like, well, how do we, as a society, keep people healthier? So you're almost like preventative care, so that they don't have to go to the doctor as much. And, just looking at, how interconnected everything is digitally now, if we can harness the power of that, like I say, in a responsible way to deliver the right information to the right people, in the right moment, so it has the greatest impact. It's all around, well, if we can make people healthier, there'll be less strain on health systems, and there'll be more money to go into, investment in healthcare, and once that gets to where it should be, just investment in other things and quality of life. But yeah, it's definitely a big thing for me now I'm a little bit older. I really quite like the kind of vision of having a more meaningful impact on the world.
Well, it definitely sounds like you do have that with Doceree, and I was fascinated hearing about your outlook on the market and what's happening today and the way that information flows and the different opportunities there are. So Gareth, I really want to thank you for joining me in these 20 minutes. This was very, very enjoyable. It went by very, very quick, but I loved hearing about the journey and about what the domain. And thank you very much for your time and for the impact.
No worries. Thank you for having me.
Thank you.